Hello, everyone, and welcome to today's episode of Gorilla Pump. So, ladies and genitals, hope you are having an amazing day. And the purpose of today is to educate, inspire, and give you information that you may not be privileged to. So, the purpose of this is to get people fit, healthy, and strong to help you understand the knowledge, the science, and the application so that you can prevent disease, you can keep yourself virile, strong, happy, healthy, and be the silverback in your home life and community by being smarter and more educated. Now, today's episode, I want to touch on the COVID vaccine. I want to touch on the COVID SARS-2 infection virus. I want to touch on the research surrounding the exposure to the virus relative to the research, give you indications of what side effects may have come from exposure to the virus itself relative to brain matter, specifically today, and also having a look at what actually is reported by research coming back from the COVID-2 vaccine. So this is not my personal opinion. This is a specifics related to the research that I'm delivering to you today, and specifically about brain matter, gray matter, white matter. Now, let's talk about what the difference between gray and white matter is. We have specific gray and white matter in our brain, and the gray matter regulates the regions of the brain involved in muscle control, sensory perception, such as seeing, hearing, memory, emotion, speech, decision-making, and self-control. Now, a disruption in gray matter and a decreased amount of gray matter has been seen in hyper-impulsive behavior. It has also been seen in people that have opioid addictions, and it also has been seen with people that have high methamphetamine use. So it just decreases people's decision-making skills, it decreases people's emotional regulation, and it also increases impulsive behavior. Now, what the research is dictated by Oxford University Press, which I'm reading right now from 2022, is from multimodal neuroimaging of post-COVID syndrome and correlation with cognition. Now, what they found in that research is that people that were infected with SARS or COVID-2 had a decreased functional and cognitive ability. And what they found is they were accompanied by a reduced amount of gray matter volume in the cortical, limbic, and cerebral areas. Now, the limbic area is a part of our emotional regulation. It helps us regulate emotions. It is also closely related to memory and the hippocampus part of the brain. And it showed volume loss showed significant associations with cognitive dysfunction. Now, these cognitive and brain alterations were more pronounced in hospitalized patients compared to non-hospitalized patients, but they didn't find any associations between the vaccines. But the indication there was that contracting SARS or COVID-2, which is the literature form of it, the COVID virus, does impact gray brain matter, which can help you deregulate emotional regulation. So what I'm trying to say is that if you have been infected with SARS or COVID, or you have been vaccinated and you're finding yourself being more impulsive, you're finding yourself being less emotional regulatory, which means you are finding it hard to regulate your emotions. You become fixated to specific ideas. You are finding it hard to emotionally center yourself to understand rationale. It may not be your fault. I'm going to give you some solutions in here on healthy application on how to combat those specific changes to help you increase the gray matter volume and balance out the differences in your cognitive function through nutrition and increase your help in understanding to help promote emotional regulation, decrease impulsive matters. So if we look at this, what a recipe for disaster. Lockdowns, COVID attacking us through the environment, COVID attacking us through vaccines or protecting us. That's a decision that you'll have to make yourself. But it's affecting our grey matter. And then what else affects our grey matter is high amounts of alcohol consumption. So large amounts of alcohol consumption over periods of time have also been proven to reduce grey matter, which affects our emotional regulation. It affects our decision-making skills. It affects our rationality to the specifics of our environment, which can make us more impulsive. Now, the next bit of research that I'm going to produce here as well is SARS-CoV-2 is associated with changes in brain structure in UK Biobank. So the abstract of the article says there's strong evidence of brain-related abnormalities in COVID-19. However, it remains unknown whether the impact of COVID-2 infection can be detected in milder cases. So in severe cases, possible interaction. In mild cases, they're not 100% sure in this specific research. Now, what they found is a greater reduction in grey matter thickness and tissue contrast in the orbital frontal cortex and the parahippocampal gyrus. Greater changes in markers of tissue damage in regions that functionally connected to the primary olfactory cortex. Now, a lot of people reported loss of taste and smell. The olfactory center of our brain is regulating taste, smell, and touch. And a greater reduction in global brain size in the SARS-CoV-2 cases. So this was actually proven in rat studies as well too, but specific cases of COVID-2 is showing that there is a global brain size reduction. So it's shrinking parts of your brain. So another thing there is too, is you become less cognitive, thought producing, the ability to think and apply rational decision-making skills. You're more likely to be a little bit more erratic. You're more likely to have dependency issues on alcohol. You're more likely to be impulsive. You're more likely to be looking for other ways to, control your emotions. The participants who were infected with SARS-CoV-2 also showed on average a greater cognitive decline between the two time points. Importantly, these imaging and cognitive longitudinal effects were still observed after excluding the 15 patients who had been hospitalized. These mainly limbic brain imaging results may be in vivo hallmarks of degenerative spread of the disease through olfactory pathways. So we do know that through olfactory, so through our senses of smell, taste are affected. Pathways of neuroinflammation events are also, or the loss of taste, sensory input due to insomnia as well too. So sleep disturbances, all the things that detrimentally damage longevity to health. Now, the next piece of research that I've got here as well too, the potential neurological effects of the COVID-19 vaccine. Now, this is a review study, and they give you indication about what COVID is, how it affects the respiratory system. The development of vaccines has soon become a virus genome. There's different sorts of vaccines, and this one was the mRNA vaccine. The side effects that were associated with the search strategy of the specific inactivated vaccines, activated vaccines, the mRNA vaccine as well too, came back that there was demyelination issues that were occurring as well too. So demyelination, the myelin sheath is parts that go over specific parts of our neurons, which make electrical currents work faster. And so if demyelination disease is where that myelination starts to deteriorate, and that is associated with the COVID vaccine as well. Now, what happens if you have demyelination disease is the myelination is slower, so it slows down electrical impulses from the brain to motor sensory units. So we have people becoming weaker, we have people becoming slower, thought processes as well of the emotional parts of the brain, regulation, thought processes all start to slow down. So along with that, along with shrinking of the brain, reported in some cases, the decrease in gray matter, so emotional regulation being slowed down from the virus, we have the contributing factors of our myelin sheath being destroyed as well too, and broken down. So the mRNA vaccine was a nucleic acid vaccine. So it's based on DNA and mRNA vaccines, and it can adapt quickly to new viruses emerging. So it has the ability to manipulate inside the body to evolve. And that's new technology to what's being used in the past. So are we being tested on? Were we test subjects? Was this vaccine rushed out? Does the vaccine give the same amount of protection as it should? Does it infect us with the virus, which is associated with all the side effects of actually catching COVID-2 through the environment? Now, these are questions that you have to ask yourself and dive a little bit deeper. But what we want to know now is how can we actually promote the increase in gray matter? So one of the questions I ask the people who have come into my office working with nutrition and health, I do ask them if they've been vaccinated. They don't have to disclose that information. I do ask them about their previous health issues, and I ask them about their mental cognitivity. There's reasons why that I ask these questions for people to gain optimal health. It's not just about losing weight, although we do know that obesity is, I would consider obesity is the gateway disease for disease. It's the gateway drug for disease. Obesity is correlated to all other sectors of ill health. But how do we promote gray matter? Well, the easiest way is DHA. DHA is a component of fish oil. Docosahexaenoic acid is the chemical name for it. DHA has been proven to increase gray matter volume. Now, the recommended daily intake is only a couple 100 milligrams, according to the reference values set by Queensland Health. But there's research out there to say that high amounts of fish oil, DHA and EPA, up to 20 grams a day, sometimes even 30 to 40, have prophylactic effects in preventing Alzheimer's, because the gray matter is associated to the hippocampus and the limbic system, which is associated to memory. Demyelination disease is also closely related to Alzheimer's disease as well too. So what we've got to understand is here, we've got to be very careful about the fish oil that we consume. Some things that people don't understand about fish oil is coming from the fish itself. So where are the fish being sourced from? What is in your fish oil? Is the fish oil being preserved with healthy antioxidants of vitamin A, vitamin E? Are they being preserved effectively? Is it good quality fish? Is it large fish? Are there traces of heavy metals in there? So what I do find is quality over quantity. You do need to make sure that you're investing in a high quality fish oil. It needs to be farmed. It needs to be freshly caught. It needs to be one of the above there to make sure that you're putting optimal in your body. What I have found is that certain studies on fish oil containing high levels of mercury and heavy metals can be proven toxic, because if you're taking high amounts of fish oil that contain mercury or heavy metals, then obviously you're putting more heavy metals and mercury in your body as well too, which can have negative effects as well. So looking for the quality, making sure that you're investing properly in healthy supplement alternatives. So today was a little bit of education. I hope you found it informative. I hope you found it educational. I hope you found it uplifting. I hope you're giving yourself a little bit of a gut check to see, are you working on optimal function? Are you emotionally regulating effectively? Are you healthy? Are you really healthy? Are you getting the right information? These are the choices that you need to make for yourself, and start sourcing out levels of information to empower yourself, to get more knowledge, to be less distracted, to apply healthy alternatives to combat the environment, to combat disease, to promote longevity, and contribute to a healthy society. And information, knowledge, education is healthy. And how do we apply it? Well, we apply it by listening. We apply it by being more informed. We apply it by being more open to ideas. And with every new day becomes new strengths and new possibilities, said by Eleanor Roosevelt. And I hope you have a lovely day. Thank you for listening to Gorilla Pump. Peace out.